Hello everyone, my name is Dr. Michael Mansouri, and today I'm going to talk to you guys about teeth in one day. This is something that patients are referred to sometimes or understand as all on 4, all on 5, or all on 6. Some of the most common questions that patients have: how much this cost, am I a candidate of, how much is this going to hurt, and how long is it going to take? At the end of this video, we're going to have a link that you can follow, so some pricing structure that we have. In our office, we have an oral surgeon, we have a general dentist, and we have a lab technician that all work very hard together to make these teeth as comfortable and as functional as your natural teeth. And as a result, we've been able to reduce some of our costs to be able to deliver some of those savings to you as the patient. Now, the question if you're a candidate or not has to be evaluated by your dentist. So we offer free consults for patients to come in so we can take x-rays and evaluate if to see how good of a candidate they are. But the concept is the same. Anywhere you seek to get these treatment done, there's a lot of deal of pre-planning before the surgery that we have to calculate and complete. What that means, you and your dentist have to get together, they have to do some models, they have to get with a laboratory technician to do a smile design to see what your mouth's gonna look like after the procedure, what size of teeth, what color of the teeth, and most importantly, how much of a bone structure you have to be a good candidate to receive these implants. Typically in our practice, we perform 5 implants or sometimes 6 implants to secure these teeth all in one day. Now, the procedure starts with us interviewing you, finding out and taking x-rays how good of a candidate you are. If you're someone that smokes or someone that's diabetic, usually it requires additional attention. If you're someone that has lost your teeth for many years, we have to work sometimes to build that bone structure to make it a little bit more stronger to receive the implants. But in general, this is how the concept's going to work. I'm going to show you guys here on this model that I have. We will study your jawbone and evaluate where would be the best places to receive an implant. We typically like to place 5 or 6 implants in your mouth to be able to support your final teeth. Now, I know some other places have 4 implants, but I really don't like to take a lot of risks. And when you do 4 implants, if in case one of those fail, the entire treatment plan may be compromised. So we like to do ours on 5 or 6 implants. That gives us a little bit more stability and reliability. We will calculate before you come in for a surgery. We will design where would be the best locations for the implants. Sometimes we create a surgical guide, which means that on a computer we'll be able to analyze and actually do the surgery on a computer to find out the best location and angulation for the teeth to be able to support your final natural looking implant supported teeth. What happens, the laboratory will be present, so they will design which size of teeth, what color of teeth is going to look the best. So essentially on the day that you come to our office, you will be sedated, so that will make the process much more comfortable. With the IV sedation, it's very safe, and our patients at least will be comforted during the procedure, so there won't be much discomfort. Once the implants are designed and placed into the jawbone, we've already made and fabricated a template for your teeth. The laboratory will be on site, so they will retrofit or already have made a set of teeth that will fit in those implants. So essentially what's going to happen, these implants will have some inserts that they're going to be completely fitted to these natural looking implant supported teeth. Once they're in place, they have some small screw openings on top that we're going to tighten up. Once they're tightened up, these implants are placed in and you go home with. Now, that doesn't mean you can go home and eat on them right away. As a matter of fact, your mouth's going to be very sore for a few weeks. We usually say up to 2 to 3 weeks, you're going to be a little bit sore. We direct you to eat still very soft foods. We want you to avoid any hard biting on these teeth. Just because you receive these implants and you look pretty nice, doesn't mean you can start functioning hard on them. We want the bone structure to have the ability to heal and fuse with the implants we place in. That's why it's more important to have 5 or 6 implants rather than 4 to be stronger and to be more supportive. But the benefit of having teeth all in one day or having a design that's similar like this, you're no longer going to have that roof of the mouth component. For some of those that are familiar with dentures or false set of teeth, you know that the roof of the mouth, the covers, it's very annoying and also makes you talk a little bit differently. And having a design like this will allow you to be able to have your dentist in future remove this process and be able to show you how to clean underneath of it. Most of the patients, after 6 months have this process placed, they will come back and have a permanent set of teeth placed in place, which means, so initially after surgery, you go home with a temporary set of teeth. This temporary set of teeth will be what you'll have for the next probably 4 to 6 months. During the next 4 to 6 months, the gums will heal around that area, your bone's gonna get stronger, and everything's gonna shrink a little bit around it. So that's when we're gonna replace and put a permanent set of teeth in place so you can start function and it'll start looking even better. So if there was anything you didn't like about the temporary one that we made during that first 6 months, we can modify and improve and change on the future set. Once you have the permanent set, that should be lasting you a lifetime. And part of our commitment to our patients, when we do the surgery, the implants, the actual teeth, all in our office, that the buck stops with us. So we won't be sending you back to your surgeon or to another office to have any issues deal with. So we'll deal with all those at our office. We'll be happy to give you guys a free consult. And if you have any questions, to contact us. Hopefully this was informative and we'll look forward to meeting you in future.